now that we have defined terms in immunity topic, it will be easier for us now to cover the topic. I'm going to give you a definition of immunity. I'm going to give you the types of immunity, and you'll come across two broad categories of immunity, where we have innate immunity, we have acquired or adaptive immunity. You'll come across terms like local immunity, you'll come across herd immunity. You're going to understand the components of innate immunity. You're born with this immunity. How does it protect you? What mechanisms does it use? What mechanisms that the adaptive immunity use? Now that we have defined terms, it's going to be very easy. We are going to flow. All right, let's get right into it. So what is immunity? So immunity is the state or quality of being immune, or we can say it is the resistance exhibited by the host against any foreign antigen and towards injury caused by microorganisms and their products. You understand, the products of microorganisms, they can produce toxins, toxoids, all those things that these microorganisms will produce in your body. Your body's ability to resist, so exhibited by the host against any foreign antigen. We have defined an antigen, yeah, towards an injury caused by microorganisms and their products. That is what we call immunity. Your body's ability to resist or to fight these microorganisms is what we call immunity. So what are the types of immunities that we have? We have two main types of immunity. We have innate, which is also called native immunity. That is one. So the second one, we have acquired or adaptive immunity. And what is the differences between these two immunities? Innate immunity is inborn, is inherited. All right, this is inherited immunity. You inherit it genetically, or however you can inherit it from your parents. And then we have acquired immunity. This is adaptive. This is learned immunity. This is something that your body learns. Your body learns to have this immunity over time. So you're not born with adaptive immunity, but you're born with innate immunity. Usually it is non-specific. It offers you a general response to pathogens, whereas the acquired immunity is specific, because this one will respond to a certain antigen that you had been exposed to before. Because for your body to develop this immunity, it has to be exposed to that. You understand? So it is specific, while the other one is non-specific. It's a general immunity that you're born with. You have not been exposed to antigens, but your body has got to be ready to fight for anything that comes. General immunity, yeah. Then we have innate immunity, or the inborn one, will offer immediate or maximum response, while the other one will give you long-term. With the acquired immunity, we will have a lag time before maximum response. Remember, this is something your body is learning. So the next time you're attacked by this, now that's when you're going to have maximum response by this one. So this one takes time, but the other one is immediate. You have it in you already. Okay. With the inborn immunity, we don't have a build-up memory, no lasting immunity. What about with the other one? With the other one, we have immunological memory cells. What do we mean by that? For you to have acquired immunity, your body has got to remember that it was attacked by this particular pathogen, and that's when it develops antibodies against it. So if you are tested, you'll be found to have antibodies against a particular antigen, even if it has been fought already by your body. But with the acquired immunity, it doesn't have a build-up memory. It's there. It is not that you had been attacked by an antigen to develop it. You're born with it. You understand? So you don't need memory for that. It just attacks anything that comes. All right? But the other one, you need memory for your body to remember, oh, we had been attacked by this. All right? So we don't need, there's no build-up memory, no lasting immunity. But in the other one, we have immunological, where we have the memory cell. So guys, we can look at the levels of innate immunity in terms of race, individual, and population or species. Let's talk about race. How is this innate leveled according to race? Or in terms of race, innate immunity can vary due to genetic factors. Certain populations may have genetic predispositions that make them more or less susceptible to certain diseases or infections. For instance, sickle cell trait provides some resistance to malaria in individuals of African descent. When you look at people with sickle cell trait, there will be resistance to malaria compared to those who do not have it. Certain races have resistance to a certain pathogen compared to another race. We can also compare it in the level of individual. At the individual level, innate immunity considers factors such as age, health status, how old are you, what is your health status. Newborns, for instance, have less developed immune systems compared to adults. So this makes the children more susceptible to infections. Additionally, individuals with compromised immune systems, such as those with HIV or AIDS or undergoing chemotherapy, are more vulnerable to infections. So this one depends on you as an individual. What is going on with you? Are you aged? Are you young? Are you immunocompromised? As an individual, that is what will be affecting your innate immunity. So we also have population, and in population we can also say a species. And how do we compare this inborn to population or species? So at the population or species level, innate immunity varies based on factors like geographic location, environmental conditions, and evolutionary history. Certain populations may have developed specific adaptations to combat prevalent pathogens in the environment. For instance, populations living in regions with high exposure to certain diseases have evolved genetic variations that confer resistance to those diseases over time. So there are some people who can survive under some conditions where others cannot survive because they are used to that. And so continuous exposure to certain environments or to certain things, certain pathogens, is going to make your body adapt to that. Something else you need to know about the innate immunity. Innate immunity is often described as non-specific, and this is because it provides a general defense against a wide range of pathogens without targeting specific pathogens. Yeah, so this non-specific response is immediate and does not require prior exposure to the pathogen. So yeah, it doesn't require, you don't have to be exposed to a pathogen before so that you can fight. And I think we have repeated this so many times, but you also have to note something. Yeah, innate immunity can also exhibit specificity in certain ways. For example, pattern recognition. So innate immune cell recognizes patterns commonly found on the surface of pathogens. For example, we have bacterial wall components of viral nucleic acids. While these patterns are not specific to individual pathogens, they do trigger specific immune responses that help to eliminate a broad range of pathogens. All right, so the first thing that can make it somehow non-specific, can make it somehow specific, like we have said it is non-specific, but we have some aspects of it that make it look like a specific immunity. The first one is pattern recognition. The second aspect that makes it look specific is inflammation. The innate immune response can be directed to specific tissues or sites of infection. Obviously, if you have an infection, where will the immune response be going to? It is to where the infection is. This specificity helps to contain the infection and recruit other immune cells to the site of injury or infection, enhancing effectiveness of the immune response. That is the second one, inflammation. The third aspect that makes it look as if it is specific, we have phagocytosis. Phagocytes are innate immune cells that engulf and destroy pathogens. So while phagocytosis is an unspecific process, certain phagocytes can display some degree of specificity in recognizing and engulfing particular pathogens or microbial products. So we have the fourth aspect, which is natural killer cells. So natural killer cells, or we also call them NK cells, capital N and K, are innate immune cells. These are innate immune cells that recognize and kill infected or abnormal cells, such as virus, infected cells, or tumor cells. While NK cells do not target specific pathogens, they can distinguish between a healthy and abnormal cells based on the surface markers. All right, so those are the 4 aspects that they'll just give some degree of specific to the innate immunity. And we have said very well that this type of immunity is non-specific. It is general. It will just protect you generally. All right, but we have those 4 aspects to consider. All right, yeah, we can talk about the factors affecting innate immunity. We have factors like age, hormones, and nutrition. And what do we have to say about those? So age, when it comes to age, we can talk about a fetus and old persons. These are 2 extremes of life. Yeah, they carry higher susceptibility to various infections. So a child and a very old person, they are vulnerable to infections than somebody who is in between there. All right, in fetus, immune system is immature, where in an old age there is gradual waning of immune responses. So when you're growing old, everything about you will just become wary little by little. All right, and with the newborn, their immunity is very young. That automatically makes them vulnerable to diseases, the 2 extremes of life. So in some diseases, clinical illnesses is more severe in adults than in young children due to more active immune responses, which causes greater tissue damage. For example, chickenpox and poliomyelitis. So guys, by this we mean that the immunity of the adult is developed compared to that of a child. So they're going to have, so the immunity will be severe, and it's going to cause symptoms to this grown up compared to the symptoms that, okay, you have to understand that when your immunity reacts to a pathogen, it's going to cause symptoms. You're going to have inflammation and all those things. So when an adult is infected, for example, with smallpox, they had been infected before, it's going to an adult is infected by smallpox, something like smallpox, the immunity is developed, so it's going to be severe compared to the child. The child's immunity is not so developed. So the severe the response, the more the symptoms. That's why you're going to see an adult affected so much by smallpox than a child, because their response is high. Oh, we also have to talk about hormones. So certain hormonal disorders will render you vulnerable to certain infections. For example, diabetes mellitus, adrenal dysfunctions, and hypothyroidism. For example, staphylococcal sepsis is more common in diabetes, which may be caused by increased level of carbohydrates on the tissues. So certain hormonal disorders, if you have a certain hormonal disorder, is going to make you more susceptible to infections compared to somebody who has normal hormonal functions. Another thing, we can also talk about corticosteroids. Corticosteroids depress the host resistance by its anti-inflammatory, antiphagocytic effects, and inhibiting antibody formation. So corticosteroid hormone has got these properties. It will have an anti-inflammatory effect, antiphagocytic effect, and it will inhibit antibody formation. So what is this hormone doing to you? All those are what your body uses to fight disease or pathogens. So corticosteroid is clearly an inhibitant of all that. Yeah, let's go to the next one, which is, so we talked about three factors that can affect innate immunity. We have talked about age. We have said the 2 extremes of life are more vulnerable to infections despite having innate immunity. Then we have hormones. There are hormones that can affect your innate immunity. For example, corticosteroids, we have seen how much it is inhibiting. We have seen certain hormonal disorders that can enhance vulnerability to infections. For example, diabetes mellitus, adrenal dysfunctions, and hypothyroidism. For example, adrenal dysfunctions and hypothyroidism. Yeah, we have talked about staphylococcus sepsis, which is, this is an infection that is caused by Staphylococcus aureus, and this is because why are you vulnerable to staphylococcal infection or sepsis? It's because you have high carbohydrates in the tissues. That is why when you have high carbohydrates in the tissue, we are talking about you having diabetes, and this diabetes will come along with things like staphylococcal sepsis. All right. A hormone like a hormone like corticosteroid will inhibit so many of of the immune response from your body. So yeah, hormones can affect your innate immunity. Another thing that affects your innate immunity is nutrition. So both humoral and cell-mediated immunity are reduced in malnutrition. So if you haven't been taking enough nutrients, this immunity is going to be affected. Your immunity will automatically be low. Yeah, so you have to be well fed. For example, in kwashiorkor, which is a severe protein deficiency, cell-mediated immune response reduces. You can imagine how the kwashiorkor is going to affect the production of amino acids. Something like the kwashiorkor, which is the protein malnutrition, will lead to a decrease in the number and the function of T lymphocytes, which are essential for cell-mediated immunity. So the T cells require adequate protein and other nutrients for their development. So you can see how malnutrition is going to affect it. Yeah. And even in the humoral, whereby the antibodies are produced, how will the antibodies be produced? And the antibodies are protein. You are severely malnutritioned, right? So that will automatically lower your immunity in all aspects. We have mechanisms of innate immunity. How does innate immunity work? So we have mechanisms, and I'm going to list them. We have epithelial surfaces, we have antibacterial substances, we have cellular factors, we have inflammation, we have fever, we have acute phase proteins. So those are the mechanisms of innate immunity. Let's explain them one by one. So what about epithelial surfaces? So in relation to epithelial surfaces, we have the skin, and this provides mechanical barrier to microorganisms. We have it provides bactericidal secretions. You've heard about sebum and sweat as well. The resident bacteria flora of the skin and mucous surfaces prevent colonization by pathogen. So apart from providing a mechanical barrier to microorganisms, providing bactericidal secretions, we have normal flora that is on the skin and mucous surfaces that prevents colonization by pathogen. So instead of your body allowing pathogens to occupy your skin, it lets the normal flora, which is the non-pathogenic bacteria, to occupy your skin. For example, Staphylococcus aureus, that is one normal flora that is usually on your skin. It is non-pathogenic when it is in the skin, but if it goes somewhere else, it is pathogenic. You understand? That is how the normal flora works. Actually, that's another topic we have to cover about normal flora, yeah? So we have seen how the skin provides that. You also have to realize that apart from all those benefits, the alteration of the normal flora may lead to invasion by other pathogenic microbes. If you alter your normal flora, there are so many things that can alter that. For example, use of antibiotics, being immunocompromised, for example, in cases of HIV and AIDS patients. These will just interfere with your normal flora and cause other pathogenic bacteria, which will cause an infection instead. So let's go to the next mechanism, and the next mechanism that innate immunity uses is the respiratory tract. The respiratory tract is lined by moist mucous surfaces, which act as trapping mechanism. So you have seen mucus in your respiratory tract, and that mucus traps bacteria. So inhaled particles are arrested in the nasal passage. On the moist mucous membrane surfaces, the hair-like cilia propels the particle towards the pharynx and are swallowed or coughed out. You know the natural reflex where you just cough. You are likely to be expelling these bacteria that have been pulled towards the pharynx by the cilia. So the respiratory tract, we are following up how it helps. So they are arrested in the nasal passage by the moist mucous membrane surfaces and the hair-like cilia. So we have mucous membrane on the respiratory tract that traps the bacteria, and we have the cilia that pulls it to the pharynx. They are swallowed. These ones can be swallowed or coughed out. And then some particles which manage to reach the alveoli are ingested by phagocytes. So you can see the type of barrier that the respiratory tract is trying to offer before it gets to the alveoli. The alveoli is very delicate. Imagine your alveoli being where the gaseous exchange takes place. Imagine that being attacked directly by the pathogens. All right. So before it gets to that, it has it has been trapped by the mucous membrane, by the cilia, and now the last bit of it is the phagocytes, and that is the type of white blood cells that phagocyte, that perform phagocytosis on the pathogens. They digest them. So the next mechanism is the intestinal tract. How does the intestinal tract do that? We have talked about the respiratory, so we are in the intestinal. When you hear about the intestinal tract, so all the way from the mouth to the intestine, how do they combat infections or pathogens? So the saliva present in the mouth inhibits many microorganisms. So the acidic pH, so we are from the mouth, let's go to the stomach. The acidic pH of gastric juices destroys the swallowed bacteria. If you swallow any bacteria, we have, the pH of your stomach is very high. We have HCl in your stomach. So it will destroy swallowed bacteria if there is any. And then the normal flora of the intestine prevents colonization of pathogens. We have bacteria present in the stomach, which is the normal flora in the stomach. So by the way, you have to know that in the intestinal tract, we do not have so many bacteria because of the transit of food. We also have acidity. For example, in the esophagus, we have an acidic environment. In the small intestine, it contains fewer bacteria compared to the colon due to rapid transit of food and the presence of antimicrobial factors in the upper gastrointestinal tract. So bacteria species found in the small intestine are like lactobacillus, streptococcus, enterococcus, and some species of bacteroids and clostridium. So in the large intestine, that is where we have, this is the primary site of microbial colonization in the gastrointestinal tract, with a diverse and dynamic population of bacteria. So the predominant bacteria pyra in the colon include firmicutes, actinobacteria, and proteobacteria. And we have bacteria like clostridium, ruminococcus, and bacteroids. We also have Faecalibacterium, and these ones they contribute to the fermentation of dietary fibers and the production of short-chain fatty acids, the ones we call SCFAs, which serve as an energy source for colonocytes and have various metabolic immunomodulatory effects. And by the way, in the stomach, no bacteria survive there. We only have Helicobacter, which is the H. pylori. This is a spiral-shaped bacterium that colonize the stomach lining, and this is well adapted to the acidic environment of the stomach. It is a very interesting bacteria. It can survive by secreting enzymes that neutralize the stomach acid. Imagine. So this is and what is it doing in the stomach? So H. pylori is associated with various gastrointestinal disorders, including peptic ulcers and gastritis. It is considered a risk factor for the development of gastric cancer. So we have this one stubborn bacteria, H. pylori, that is in the intestinal tract. It's a normal flora, but when it starts causing stomach ulcers, it becomes a threat. All right. So the next mechanism that innate immunity works is through conjunctiva. So when you hear about conjunctiva, you are thinking about the eye. So tears flush away bacteria and other dust particles. And then we have lysozyme. This is present in zea. This is an enzyme present in tears, and it has bactericidal action. Bactericidal is an effect of fighting bacteria. So in the conjunctiva, we have tears to flush away bacteria and other dust particles, and we have lysozyme that is present in tears, which contains bactericidal action. Then the next mechanism is genitourinary tract. So the urine eliminates bacteria from the urethra by its flushing action. Obviously, when somebody is passing urine, you're going to flush some of the bacteria. And then we have the acidic pH of the vaginal secretion of the female due to fermentation of glycogen. And this fermentation is by lactobacillus bacteria. This is a normal flora in the vaginal tract. So it makes vagina free from microorganisms. So we have the acidic pH of the vaginal secretion. And in males, semen is believed to have some antibacterial substance. So we are done with the epithelial surfaces, where we have seen the skin, we have seen the respiratory tract, we have seen the urinogenital tract, GIT tract, we have seen GIT tract. So we're in the next mechanism, that is in the antibacterial substances as a mechanism. Antibacterial substances in blood and tissues. So which are these antibacterial substances in blood and tissue? There are a number of antibacterial substances that is present in blood and tissues. For instance, we have beta-lysine, we have basic polypeptide, we have acidic substances, and then we have interferon. So let's touch a little bit on them. So beta-lysine, what are these? These are relatively the most stable substances, active against anthrax and related bacilli. Beta-lysine, so this is the most stable. It can tolerate high temperatures, and it is active against anthrax and related bacilli. We have basic polypeptide, for example, leucines and plaquings. Acidic substances, we have lactic acid that is present in tissue and infected area. We also have interferon. Interferon protects against certain acute and viral infections. So when we talk about beta-lysine, what are we talking about? These are relatively stable substances, active against diseases like anthrax and related bacilli. And this is produced by various cell types, including epithelial cells and leukocytes. Its expression can be induced by bacterial infection or inflammatory signals. It comes around when those bacteria are produced. And by the way, it is particularly against gram-positive bacteria, right? And then we have basic polypeptide. What is this? So basic polypeptide is a chain of amino acids that is characterized by presence of basic amino acids residues such as lysine, arginine, and histidine. When we talk about these, we are talking about amino acids. That's another topic we're going to cover. Amino acids, we have essential and non-essential amino acids. That's where they are coming in. All right, so basic polypeptides, and they have various biological functions such as DNA binding, enzymatic activity, and microbial properties. That's why they are here. Then we have acidic substances. What are these? Acids like lactic acid that is present in tissue and infected area. We also have interferon, and these are proteins against certain acute and viral infections. Interferons will cause an effect by activating intracellular signaling pathways that lead to expression of genes involved in immune defense. And we have three main types of interferons. We have type 1 interferons, that is IFN alpha, IFN beta, and then we have type 2 interferon, that is IFM gamma, and type 3 interferons, which is IFN lambda. Okay, just hold on there, just know they're there. You'll understand them there. So they're used for, so interferons are used therapeutically to treat viral infections, certain cancers, and autoimmune diseases. So I think when it comes to antibacterial substances in the blood and tissue, we can leave it at that point. We have beta-lysine, we have basic polypeptide, we have acidic substances, and we have interferon. Yeah, so let's go to the next mechanism. So we have cellular factors as the third one, the third mechanism of innate immunity. Once the infective agent has crossed the barriers, which is the skin, tissue factors come into play. Now this infection is in the tissues, and the process is invasion of tissues by infective agent, accumulation of phagocytes in the site of infection, deposition of fibrin that entangles the organism, act as barrier to spread the organism. So fibrin formation, you know how the fibrin is formed. So phagocytic cells will ingest these organisms and destroy them. So that is how it goes. It invades an organism. Guys, the next mechanism that we have of innate immunity is inflammation, and this is a complex biological response to the body's immune system to harmful stimuli such as pathogens or injuries or irritants. And how does this even happen? So we can say that this is an important non-specific defense mechanism, and it occurs as a result of tissue injury initiated by entry of pathogens. And inflammation leads to vasodilation, increased vascular permeability. So we have vasodilation, so the blood vessels have dilated, increased vascular permeability, so the more blood will be supplied to that particular place. So and cellular infiltration. Cellular infiltration is the migration of immune cells. We have lymphocytes, neutrophils, macrophages, and eosinophils into the tissue or organs in response to inflammation. So the reason why we are having this vasodilation and vascular permeability is so that these immune cells can go to that particular area, yeah, to do their immune duties. So due to increased vascular permeability, plasma pours out and dilutes the toxic products present. Fibrin barrier is laid to wall off the site of infection. So you've seen lots of blood cells have gone into that, and you know the work of blood cells, the platelets will start doing their job of forming fibrin. That is also another process that is, you know, a long one. So in the site of, so when inflammation is taking place, where you'll hear somebody saying they have fever, is because all these things are happening. There's a lot of blood supply to the area, there's a lot of cells in the area, and fibrin is being formed. All those things are happening in the site of infection. All right, so we had that mechanism, which is inflammation, and then we have fever. The fifth mechanism is fever, and we are talking about mechanisms of innate immunity. So rise in temperature, we have rise in temperature following infection is a natural defense. This is a natural defense mechanism, and it destroys the infecting organism. So it stimulates the production of interferon. We have talked about interferon, which are the signaling proteins, which help in recovery from viral infections. The sixth mechanism, we have acute phase proteins. After injury, there is sudden increase or decrease in plasma concentration of certain proteins, collectively called acute phase proteins. And examples of these acute phase proteins, we have C-reactive proteins, we call them CRP, we have mannose binding proteins, and so on. So they activate the alternative pathway of complement. They also prevent tissue injury and promote repair of inflammatory lesions. We have seen how these mechanisms work. So they start from the barrier, coming on to the tissue, to the blood, and then we are to the inflammation, to the fever, then we are in the acute phase protein. We are done with innate immunity, and we have learned so many things. We have seen that this is an immunity that you're born with. It's an inborn immunity, and we have seen the mechanism it uses. We have seen the factors that affect it. We have learned so much about it by now. So we are going to tackle the acquired or adaptive immunity.